Hi everyone, this is day 13, the issues about the health and the health care. So nobody can be healthy and stay healthy in the entire life. So you may need to see the doctors or visit the medical professionals for the care or preventive care. So this is the issue of our daily life or our life in the later life conditions. So we will see what are the health and health care in the US and see what are problems and the possible solutions about the issues about the health and health care. So the main questions in this section are whether the social class linked to the health and illness or how people's socio-economic conditions such as race, gender, social class impact the rate of the illness. Also, the socialists do not deny the medical causes because usually the physicians in the medical field emphasize on the biological factors or other infectious factors. However, sociologists usually weigh on the sociological or social factors such as their social background or their healthcare system or their communities. So we think that these are the bigger factors as well as the other factors of the medical causes. So we do not deny the medical factors causing the illness, but we have some more emphasis on the sociological or social factors. And what are the major social problems related to the health and healthcare system in the US? So, as we always do, we just limit our scope in the US issues other than the international issues. Theories of health and healthcare. So you may imagine what we will cover here. So functionalism, conflict theory, and the symbolic interactionism about the health and healthcare system. And there are three key terminologies. So as the health is the multidimensional concept, refers to the extent of the physical, mental, and social well-being of the individuals. The medicine is very similar with the hospital system or professionals of the health system. These are the social institutions that seek to prevent, diagnose, and treat illness and promote health in various dimensions. So we will refer the medicine in this section as hospitals or physicians and other all related to health professionals. Healthcare is the provision of the medical services to prevent, diagnose, and treat health problems. So medicine and healthcare are closely related and not distinguished very clearly. In the functionalism perspective, the good health is very effective and very essential for the social well-being. So a very good health condition of the individuals and the effective medical care system is very important to create and to maintain the stable society. Essential so our society function well. The premature death is not very good in this function or in this theory. So it's actually not good, but they say that this is not good because the dead people cannot carry the social roles and it prevents the poor returns. Because if the people die in the young age, it will have some like a poor return from the costs in the pregnancy period and the birth and child care and other all related spendings. So it's very cynical and very dry perspective for the value of the individuals as the return. So poor medical care system is also dysfunctional because it's not effective for the society because it results in the bad health of the individuals and results in the premature deaths eventually. So the good health of the individuals and the good medical system is very essential for the stable society. So there are some like a very unique perspective for the sick people. They say that the sick people are eligible to be treated as a sick people, and then they can be exempted from the roles of they had. So they have like a less sympathy for the people who have negative health behaviors. So, for example, if the people is sick because of their bad behavior like heavy smoking or heavy drinking and bad fat or the bad dietary, they are less likely to be treated as a sick people. Well, they can be treated as a sick people, but they have like low expectations to be treated as the sick people, exempted from their social duties. So sick people are expected to confirm their illness by the health professionals. So not just by saying that they are sick, they should be confirmed by the professionals as they are sick. So they are treated as a sick people and can be exempted from their normal obligations naturally. So physician and patient relationship is very hierarchical. Patients should follow the order of the physicians and other all health professionals. So if they do not follow their order actively, they can be sick again, and they cannot be overcoming their sick condition to be to become the health people again. So the physician and patient relationship is very hierarchical. Physicians are upper order, and the patient should follow their orders. There are many criticisms for the functionalism, usually the critical theories and the conflict theories. So those perspectives for the sick people is limited to the short-term illness. So they expect the sick people can be treated and become healthy again and come back to their social roles again. However, there are many long-term illness people who are chronically ill and or usually so permanently ill. So this is not appropriate theory to explain about the long-term illness. And it also ignores the roles of the social background on the health condition, as you already mentioned about the impact of the social class, ethnicity, race, and gender. Patients today need to be more active, so they need to reduce the hierarchy by asking more questions and taking more active roles to maintain their health as the preventive method, like practicing a lot, exercising a lot, and know about the good health behaviors. So the hierarchical order between the physicians and the patient is not very appropriate in these settings of the society. So hierarchy is needed because if the patient do not follow the orders by the physicians, they may lose their health. But hierarchical order is not always good because patients should ask more questions about their conditions and what are the better methods or better treatments for their needs, not the needs of the physicians or finance condition of the physicians. Conflict theory emphasizes inequality and the quality of the health and healthcare delivery. So they have like a health level is largely varies by their social class, race, ethnicity, because of the different stress level or the disadvantaged environment or the healthcare providing conditions. So people from more disadvantaged social background are more likely to be ill and then ill again, and harder to overcome their illness to become healthy again. So inadequate health care makes it more difficult to become well when they are poor. So they also provide a criticism toward the physicians and the medical professionals and the healthcare system. They criticize that the physicians and the medical field professionals try to control the practice of the medicine and the social problems of health as a medical one. So they want to limit the illness problems or health conditions as the biological or the medical conditions, ignoring the social conditions. So they say that ill people are ill because of medical condition. They try to maximize their benefits by defining or monopolizing these medical issues because they want to limit their treatment by their qualifications and their treaties. So if the health issues are just limited into the medical treatment or medical field, more possible social routes and the potential social solutions will be neglected, such as improving the health condition of the poor or reducing the level of poverty. In their perspective, these are neglected because these are the direct causes of the health or the health conditions. So eating disorder can be the example. So it was like only medical treatments by the medicine counseling, and it was very treated as just before the medical issues. However, it could be rooted from the cultural issues such as the order of the beauty in the society. So it is advertised that the thin or some volume of the woman could be very treated as the ideal, but not in the medical fields or other other fields, being a thin people would not be great for the health or conditions. So maybe changing the cultural roots of the standards of beauty can be the remedy of the eating disorder, but physicians and medical professionals just want to limit the treatments of the eating disorder in their own field, not the social order changes. There are also criticisms toward the conflict theory, as conflict theory is overacting about the health condition, the inequality. So there are clearly many improvements of the medicine. So medicine would be the best way to cure the patients, but not all motivation of the medical professionals are just originated from the economic considerations. So they criticize that physicians are moving by the motivations of their finance. They may want to maximize their benefit, but they also have like morals and ethics that help the patient to recover their health. So we cannot guarantee that all motivations of the medical professionals are just by the benefit or the profit. So even their maximizing efforts of their benefit result in the improvement of the medical science. So we cannot deny the improvements of the medical system is beneficial for the patients. But anyway, there are negative aspects of the medical experiment motivation for the accepting their rich remains. A company and the economic motivation other than patient well-being is not ideal. So they want to maximize their benefit, not maximizing the benefit of the patient. So this is not a good situation for the patient, because they want to if they want to maximize their benefit, they would ask some medical exams, not very ideal for the patients, but very ideal for their finances of the physicians. So this is not good situation for us, most of the public. So symbol interaction emphasizing the social construction of the illness. So they say that physical and mental conditions are not objective situation, but defined by the society and its members subjectively. So they say the social behaviors and health conditions were not previously defined as the illness, but now considered to be illness because of the development of the medicine and the usage of the medicine for the benefit of the physicians or the medical field. So ADHD was just considered as overactive in some decades ago, but in these days there are many exams for the ADHD and the medicines of them after the development of the Ritalin, which is the medicine for the ADHD. So determining obesity. So there are many counteracts as the fat pride or fat acceptance movements that perceiving the obesity is not a disease or not the shortage of the people of the motivation, but this is also the criticism that the similar iteration of the social constructions are minimizing risk of the obesity by the movements of the fat pride and the fat acceptance. So in summary, health and illness do have some subjective components as the constructed by the social beings, but it also has the objective reality as the condition of the medical conditions such as biological conditions tested by the medical exams. So there are some criticism that there are the serious health conditions exist regardless of the objective definition process or subject definition processed by the society. So they say that the illness or the types of illnesses are defined by the society. However, there are serious conditions regardless of the definition by the society. So we can always say that the health conditions are defined socially, and they neglect the inequality for the health and illness by their social economic conditions. So these are limited functions or the limited perspectives of the symbol interactionism. So I want to cover about the social problems related with the health. The poor status of American health. So as we covered before, U.S. is a leading U.S. has a leading economic condition. So it has like a very developed technologies, including the medical science and the hospitals and the facilities and the quality of the medical treatment. But 14.5 of the U.S. households are lack of the sufficient money for the possible or enough quality of the food and nutrition. So at least part of the year, and the 20% all children are in that household. So because of the malnutrition and the malfood situation, they have the relatively bad health condition compared with the wealthier family who have some sufficient money for those food and nutrition. And ironically, even though U.S. has the highest level of the wealth condition, U.S. has the high rate of the low birth weight newborn babies and the high rate of the obesity, which means some bad sign for the health for the children. And many figures relate the health condition imply the long way to improve the nation's health condition. So compared with the other well-developed industrial countries, the U.S. has some negative or a low status of the health indicators. So the U.S. has the very high health disparities. So health disparity means like inequality or the measure of the how health and illness vary by their socioeconomic characteristics. So if the poor people are highly likely to be poor highly likely to be unhealthy or have some illness compared with the higher level of the social class, we say that the society has a very high health disparity level. So if the poor are more likely to be ill compared with the rich counterparts, we say there is a health disparity in some certain level. So racial ethnic minorities are more likely to be ill because of the social class and race and ethnicity by the gender. So we will see the effects of the social class and race, ethnicity, and gender on the mental and the physical health. So social class play a big role in the health of the physical and the mental health condition. Poor people are more likely to have worse self-reported health, such as I think I am healthy, or I am good, or I have some social health condition or poor health condition like that. So stress and sense of little control on the job market or their workplace, and their relatively bad living condition and lack of access to the health care, lack of education, and unhealthy lifestyle contribute to bad or worse physical health compared with their richer counterparts. So there is like a causal question problem. So maybe the poverty leads to physical and mental illness of the more prevalent in the poor or poorer social class. However, maybe the physical, mental, or mental illness can lead the poor condition or the poverty because they cannot work properly because they are sick or they have some mental problems. They are more likely to be poor because of these mental or the health conditions. However, most scholars believe that poverty contributes more. So poverty comes first, and then the poverty result in the mental and the health, mental and physical health problems compared with the livers. So race and ethnicity also plays a big role in terms of the physical and the mental health. So racial and ethnic minorities have some worse health indicators such as infant mortality, life expectancy, and other chronic diagnoses. So compared with the whites and other races, African Americans and Hispanics are more likely to have those bad health condition indicators. So prevalence of the poverty difference is like a big problem, as well as the dietary in the culture. So first generation of the Hispanics had the better health condition compared with other minorities such as African Americans because they had more healthier, they had some healthier food dietary such as eating more corns or eating more beans or eating more vegetables originated from their culture. However, after like a second generation or third generation, they soon adapted from the typical eating behavior of the typical Americans, like having more hamburgers or having more meat, resulting in the problems in the health conditions. Then their health has been worsened by the generation and the generations. And also discrimination also matters for the worse physical health condition for the ethnic or racial minorities. And so this is a little bit controversial because of the prejudice problems. It's very hard to say directly, but some biological scholars found some biological basis, such as higher level of the growth of the protein for the African Americans. So if they have some like a higher receptor for the protein, and they are more likely to have some like growth level of the protein, usually result in the higher level of the cancer. And differences of the blood vessel distribution of the African Americans compared with the other races, usually whites, and absorbing level of the nicotine may contribute to health gap of the African Americans between whites or among other races. So it's very careful to say about the biological difference because those biological bases were misused to legitimate or justify the racism or discrimination. But anyway, scholars find some evidence that there are some biological bases negatively impacts for the health level of the African Americans compared with other races. In terms of the physical and mental condition, there are so many impacts of the races, but there is no clear evidence about the connection between the racial ethnicity impacts on the mental health conditions. But anyway, at least there are some signs of the mental distress. So African Americans are more likely to have some distress or mental distress compared with the whites or Asians. So they tend to have some worse health condition in terms of the mental distress signs. However, many studies found that racial and ethnic minorities have some similar level of the mental health condition with whites, even though they have some higher discriminations or racism they have to face in their daily life. So in terms of the their similar level of the mental health issues, maybe African Americans and Hispanics are stronger, or they are more stronger, and they have some like a better coping up the strategies than the whites, even though they have a similar, even though they face like a higher racial discriminations or racism, and then they have a similar level of the mental health condition. So maybe in that viewpoint, Hispanics and the African Americans are stronger because they have some better coping up strategies, and they have some better social network like extended families or relatives. So gender also plays a role in the physical and mental health condition. So women have longer life expectancy. So in terms of the lifespan or the longevity, women are healthier than the men. However, women have several worse health conditions such as the health quality and the number of the illness they have. So there is like a morbidity paradox termed as the woman's like a longer life expectancy, but they have some like bad health indicators compared with the men. So it's maybe because women live longer, so there are like more older people who are more vulnerable to the health risks. So that's why a woman have more like a worse health indicators compared with the men. However, after controlling the age, I mean, when they compare the same age people or the removing the effects of the age, like removing the people on the old age or something. So if they are in the similar level of the age or the income or something, women still have worse health condition than men. So usually in terms just removing the age effect, we can see women are poorer and they are more stressed in their workplace and in the home because they are more stressed because of discrimination by gender, and they have the higher burden for the household works or their duties. So men are less likely to seek the help for their medical problems. So the men are more likely to have some like a severe condition of their health compared with the woman because they do not see the doctor more frequently than a woman. So men also have some like a more life-threatening disease and a bad lifestyle than women, contributing shorter life expectancy or more deadly conditions infecting their risk of the death. So women has like a various sex-linked biological differences make them less susceptible to many life-threatening illnesses. So for the life-threatening illnesses, women are more stronger than the men. But still, women have higher rates of those mental health problems such as depression and manic depressive disorders. But men have higher rates of the antisocial personality disorders. So it's very hard to say that a woman or men are more likely to have the more like a worse health condition compared with the counterpart. But still, a woman's worse physical health may account for the poorer health condition in terms of the mental health condition, because you may remind that even though women live longer, they have like a bad or worse health condition indicators, but maybe because of those mental or physical health indicators imply some poor condition of the mental health for the woman compared with the man. So this is it's very hard to say in the word that women or men are more susceptible to the some specific disease. So there are also social problems in healthcare. So I think many of you face some like similar problems of the healthcare or health insurance problem of the like a high cost or the errors of the hospitals. So there is like an issue of the lack of health insurance. So medicine or the hospital or like a health professionals are some like a big business in the US. So even though the US has the very highest level of expenditure for the health, various level of the health indicators remain not good compared with the wealth level. So US is like a leading country in the economies and the development of the health science or medicine. However, we still have like a lag behind indicators of the health like infant mortality or obesity or other mental health problems. So the private health insurance is a big problem or root of the problems of the health care because US don't have the national health insurance. So some countries or many industrialized or wealthy countries have the national health insurance program, like a single payer program. So we cannot say these programs are the perfect or ideal because it has some problems like they have to wait like 2 or 3 months to be treated, but still anyway they can have some any treatments without some paying or high amount of money. So US under 65 US don't have the national health insurance program but private health insurance program. So private health insurance program are very expensive or usually covered by their employer. So if you are not employed or if you are fired from the employer or the corporation, you will not have the health insurance coverage. So you will be under like an insurance condition, and this is like related with the economic condition and the economic cycle. So especially with the combined with the issue of the unemployment, this is very big burden for the poorer classes or racial or ethnic minorities or the women. So 16% of Americans are not insured. 22% and 32% of the African Americans and Hispanics respectively are not insured. So lack of health insurance easily results in the failure of receiving preventive or other appropriate health cares. So uninsured people cannot get appropriate cancer screenings, so they are more likely to have some more advanced cancers compared with the people insured, because insured people have some more appropriate cancer screening treatments. They can find the cancer in the earlier stages. So even though 29% are covered by the public insurance, such as Medicaid and Medicare, the coverage level cannot cover the whole expenditure. So after the deductible or the coverage limitation, individuals in the coverage should pay for some amount of money as out of the deductible or out of network or something. So they need to pay some certain amount of money after the coverage. So this is the figure you can find the expenditure after the coverage, or the whole level, the average level of the expenditure they need to pay for the health care. So in the left-hand side graph, you can see that US is far higher. So US placed like far higher than Switzerland, other Norway have some higher high level of the health expenditure. So you can see more than $2,000 spent in the health expenditure. So the Switzerland and Luxembourg and the Norway are the leading countries in the health expenditure, but you can see about 25% of the higher level of the expenditure compared with the second level or second leading country in terms of the health expenditure. So compared with the other wealth countries, you can see these are some like a high expenditure compared with the other countries. So if the US have some very good quality of the healthcare system, it's very unreasonable that have some we have the high expenditure of the healthcare system. But as we mentioned before, we have the lag behind indicators of the health condition. So maybe we can say that we are spending much more than it should be or is supposed to be. There are many regions of the healthcare expenditure. So we have the many private health insurance companies. So we have the high administrative costs. So if we go to see a doctor, they should send their papers to the insurance company, and then the insurance company should review those claims, and then send the paper to the health providers again, and also send the paper to the physicians or the patients that what are the how much we covered and how much were not covered, and then we should send the check to the insurance company or the physicians again. So the cost like a hordes of clerks and accountants are needed to work with this the insurance paperwork. So even the United States have one of the most advanced electronic or technologies. They are doing the paperwork by the papers instead of the electronic system. So there are the high administrative costs that they should hire for the clerks or accountants or other people for them. So private insurance like a P4 service. So medical professionals can charge relatively free or whatever they want. So if they want to charge $1,000 for the exam, yeah, they can do that. So they do more. If they have some more exams like a medical exam, they can earn more. So it's very unreasonable for them to ask or recommend more medical exams or recommend some more medicine for their finance. So this is also the problem as the health maintenance organizations, as called the HMOs. So maybe many of you are the insurance subscribers. If you have at least one health insurance, you can see who are the in-network or out-of-network physicians. So insurance subscribers must visit the physicians, approve the list of the physicians by the HMOs. So if you pay more money, maybe you can meet some the physicians out of network in terms of the even if you may need to pay some higher amount of money of the deductible, you can meet some physicians out of network. But many of the insurances, especially for the low paying insurances, you must visit the physician in the network of the health insurance company called health maintenance organizations. So in the traditional private insurance model, it didn't have some this network or other things at least, but it's less expensive for the employers. I mean, they can pay less for this HMO model compared to the traditional model. So otherwise, we should. If we want to meet the physician out of the network or out of the HMOs, we need to pay without the insurance coverage. So this is a problem because If we have some physician we had met for a very long span, so the physician may know about you very well, and maybe you know about the physician very well. But if the physician moves their hospital, and then if the hospital is out of the network, you may need to change the physician because of the benefits or because of the interest of the your insurance company or HMO. So it often limits type of the medical exams and procedure. So even if the physicians have like a better methods or better exams, they cannot do that because these are not covered by the insurance. So HMOs claim that or insist that these practices are inevitable or necessary to cut the costs of the medical expenditure, not harming the people or patients in their opinion. But we are not sure. We are not sure it's inevitable for their benefits or inevitable for our health. I don't know. So there are also the quality care problems. So these are related with the quality provided the service provided by the medical professionals. So it is well known that medical professionals, especially for the physicians, had very short average the sleep time. So it is compatible. So 24 hours of the sleepless working hours for the physicians are compatible with the drunken driver, causing more errors and long surgery time. So it may lead to some like more mistakes by the physicians compared with the long sleep or enough sleep. And shortage of physicians and nurses because the economic motivations are driving them a lot for the relatively low-paying positions like emergency rooms or rural area. They have like a shortage of physicians and nurses, usually increases the prices of the medical services. And there are high mistake hospitals. So there are many wrong diagnoses and wrong drug infection and all other mistakes compared with the high expenditure in the US. So I don't know how many of you experience this kind of mistakes like wrong diagnosis, and sometimes they provide wrong medicine, or they do send some like a wrong network, like causing the failure of the insurance coverage because of their mistakes. But yeah, maybe they are responsible, but we also need to take care of those issues by ourselves, like spending our money and our time. So these are some like a very huge waste of our time, our money. So because of the mistake of the hospitals. So these are some problems of quality of the healthcare. So there are many medical ethics and fraud issues. So billing for exams or tests were not done according as it goes to patients. So they are billing for like the test is never done or never examined. And the referring patient for their own lab or the invested ones. So these are called like a self-referral. So this not it's not illegal. So it is illegal anyway, at least. But there are some ethical questions that whether these are like self-referrals are the best interest for the patient or best interest for them. So if they move or refer the patient for their own labs or own the rooms or other the hospitals, maybe they can earn more. So if it can be very good for their finance, we are not sure it's like a better fit for the patient interest or not. So there are some like a drug trial premium issues. So if the physician recommends the patient to sign up on new drug or new medicine, they can earn more than 1,000 for each patient per each sign up. So they are more likely to ask some more patients for drug trial. Might not be good for patients, but good for physician finances. So there is no clear evidence, and we cannot know before they admit these traditions or tendency. But we still see that there are some like a drug trial issues for their physician finance. So there are some solutions we can see to improve the health and healthcare conditions. So the reducing the poverty will be some like a fundamental solution for the poverty or the poor people, because the poor people are more likely to be ill and in the more like worsening conditions. So removing some or reducing the level of the poverty will be very helpful fundamentally. And the government-run single-payer system, such as the Medicare for all ages, can be very helpful to improve the health of all Americans. So there are many cases. So as I mentioned before, there are many cases of the national health insurance system. So national health insurance system means that they cover the they do not cover the whole amount of the money paid for the medical treatment, but they cover all the people. They cover the medical care system for all citizens. So if they pay some amount of money, they can if you have some cold symptoms, maybe you can see the doctor without the private insurance, but the national health insurance. So let me share my experience back in South Korea. So before coming to US, I live in the South Korea, has the world leading national health system. The government runs the national health company. We call it like a national health company. So they cover a whole amount of the most of the health coverage. So if I want to see the doctor because of the cold, I just need to pay about $2 or $3 for the to see a doctor, or $2 or $3 for the medicine, because they cover most of the expenditure in the health. So we cannot say which system is absolutely better in the holistic meanings for the whole economy of the nation or something, but at least for the health condition or the burdens of the health conditions or the health expenditure, many national health insurance system and single payer system can have some benefits for the general level of the health, or successful examples in many other democracies. So Denmark or the UK or Canada has some good national health insurance system. Could be improving the general health condition level of the citizens in the country. Maybe improving and expanding the preventive health care system would be very beneficial to prevent the health problems, and reducing the cost of the health care errors of the hospitals and the medicine could be helpful to improve the health indicators in the US. So as we always do, make sure to submit your quizzes and assignment on time, and let me know if you have questions. And also please check the survey I uploaded yesterday, because this is the graded survey for your extra credit, and about the schedule for the next Wednesday, because I originally have some one course, like additional chapter outside of the textbook, but maybe I'm considering to have one day off without some quiz or having lecture, to help you to have more time to prepare the exam. So it's really up to you. So both of the options are work for me. So let me know if you prefer another option than another. And then this is like a 0.5% of your total grade as the extra point. So yeah, you may not miss it. Okay, so thank you for your time and see you tomorrow.